Thank you for the invitation to participate in this particular forum. What are our obligations in terms of phytosanitary measures for market access and what it is that we must do? Of course, the starting point for all of us is the IPPC. What does the IPPC say that we need to get done? And with regards to an NPPO standing for the National Plant Protection Organization, I'm saying this because I was in a meeting the other day, and after long discussion on plant health issues, somebody asked, what does NPPO stand for? I assume we all understand what it is. Part of our obligations within the SADC region is for countries. We must, as contracting parties, and I'm looking here at the 1997 revised text. So administer the NPPO, designate the official contact point, submit description of the NPPO, and notify of any changes. Implementing the IPPC, and it has got so many things. And a key and a very important thing, which goes beyond the IPPC, transparent sharing of information. And then, of course, research in the plant protection area. These are critical things which we all, I believe, are conversant with. We all know what the responsibilities are. But as we will be discussing going along, we need to be asking ourselves the question, if we do understand this, have we managed to communicate the same to other stakeholders within our countries? And when I talk about other stakeholders, I mean, as an NPPO, you are a part of the plant protection world. The plant protection world falls under the ministries of agriculture, maybe food systems, and all that kind of things. So you have a responsibility to your country. At the same time, there is the private sector. Remember, the NPPO does not operate in a vacuum. There are those who utilize or consume your service. So there is also the private sector. So the issue we need to be asking ourselves is, have we been effective in terms of communicating what we do in the plant protection world among the private sector and the public sector? And are our services appreciated and recognized? So moving on, and this is a list of the many things that NPPOs handle: legal and administrative systems, strategic planning, PRAs, sampling and testing, inspection and verification, emergency action, staff training and development. It's a whole list of very many things that are expected of an NPPO. The question you ask yourself is, as an NPPO, are we really structured to effectively implement these things? Do we really have the infrastructure to implement this? Do we really have the human resource component to implement this? And from where I sit, I always argue that the most important aspect of any organization is the HR component. Remember, today we are talking about a meeting of NPPOs. Is there any PPO in this meeting? No, it is the human beings associated with the NPPOs in those countries who are in this meeting. The NPPO in Zimbabwe, the NPPO in Botswana, the NPPO in Eswatini are not in this meeting. It is the human beings associated with the NPPO or employed by the NPPO who are in this particular meeting. So we keep asking ourselves, what is our structure to enable us implement our role within the NPPO if we really want to be effective? So there's the HR component, and then there is the infrastructure, and then we will be talking about things that do exist within that particular NPPO. And we also know for a fact that under the IPPC, we have got the international standards for phytosanitary measures, whose aim is really to protect sustainable agriculture and enhance global food security, protect the environment, forest, and biodiversity, and the key for today, facilitate economic and trade development. Remember, the term is facilitate. Now, I'm stressing on this because there is a tendency, and I'm talking this from the experience I've had in the last 30 years or so, that most of us within the NPPO look at ourselves as controlling the trade, as being the ones who are responsible for this. And we forget that it is our role to facilitate. A number of the NPPOs would be very happy to say, we stopped company X from exporting. We stopped company Y from doing this. Is that really your role? Or did you go beyond stopping and try to find out what was the problem and how can you encourage that particular company or individual or institution to be able to continue with its economic activity? So we say it is the standards are aimed at facilitating economic and trade development. Consequently, the R44 adopted ISPMs, 29 diagnostic protocols, 39 phytosanitary treatments. But the key really is, do we really participate in the development of these standards, or we are only consumers? Can we really actively participate in this? The diagnostic protocols and the 39 phytosanitary treatments. Do we really understand what they are? What do they mean? Are we able to implement them? Have we domesticated them? The other day I was in a meeting and somebody says, we are using ISPM. So I asked, what is an ISPM and how do you use it? Of course, I didn't get an answer. The issue is we need to move beyond talking about these as NPPOs towards actually domesticating these ISPMs. And remember, under the WTO, we have the luxury of adopting even higher standards. That means there is an international standard, but if we are able to show other means of actually implementing that international standards, we can do it. So this is what is in place for the NPPOs in terms of getting the work done. But I would like you to keep in your mind the question that is at the end. What has been our role in formulation of these standards or formulation of any standards that is under development? Are we able to provide data? And there is a guide. The topic today was on market access. IPPC has gone ahead and prepared a guide that you can use, which means we just need to read it and be able to implement it. But to do this, do we really understand what our rights and obligations as NPPO are? Remember what I've talked earlier about in terms of facilitating trade. And the guide also does provide some guidance on how you can get to achieve market access and maintain trade. So why is it important to talk about market access? We know very well, at the end of the day, trade facilitates new opportunities and welfare for countries. All the countries within our region, we say we are agriculture-based. And of course, today we are talking about plants, but there is also food products and there is also animal products. And we also know phytosanitary issues are a key in determining or facilitating or allowing trade. That means a decision that is made by any of the SADC member countries would be made best in terms of the expertise that exists on phytosanitary issues. That means yourselves. And we also know that phytosanitary import requirements need to be established in a transparent and participatory way. When were your regulations last reviewed? When were your standards last published? Do you share the information? Do you have a link that if I needed to import my material from either from Kenya to Seychelles or from Seychelles to Zambia, I would clearly find the information on somewhere? Or do I need to go visit somebody who will then tell me what I need to do? Lastly, there is the issue to increase the capacity of the IPPC membership to undertake the necessary procedures to negotiate market. That means you start from somewhere and you have to continually interact with the system, contribute towards it, and therefore you increase your capacity. Remember, if you are not participating in the process, you are not learning. And therefore, it behoves us to ensure that we actually engage with the other players within the IPPC world in terms of what is required of us. And therefore, I come to some of the key things that I think are very critical. And we need to ask ourselves, as an NPPO, where are we in terms of fulfilling our IPPC and WTO obligations with regards to market access? And this becomes a very big challenge. Within the SADC region, I think you've seen the poll rating that has gone on. Average, somewhere some things have been put up, but is that really where we are? If we were to do a critical assessment of ourselves, where are we really? And based on this question, there's a question that I have been asking for the last 15 years, not 15, I think 25. The issue is, what is the current proposition of the NPPO in the agriculture sector and the overall economy of the country? If you are in the NPPO in Zambia or Zimbabwe or Tanzania or Malawi, for example, working for an NPPO, if there is an issue that you would like to pursue, how is it treated? What I have found is that most of our NPPOs, we are at the bottom end. Sometimes back we used to say you are at the bottom end of the food chain. NPPOs only become critical to most of our countries when there is a crisis. If there is no crisis, nobody remembers there is an NPPO. And therefore, the actions and activities for the NPPO remain subsidiary or secondary unless there is a crisis. You cannot develop an NPPO based on crisis. You can take advantage of it, but if you are only going to depend on a crisis, then it becomes a problem. So we need to start thinking about how do we enhance the value of the NPPO within the overall economy of our countries, because that is how we will improve our ability to implement the obligations with regards to market access. Then the next question that comes to this is, when can we say the NPPO is performing well? And how do we measure this? You have rated yourself. Yes, you are doing your obligations. What is the criteria of it? Is it based on an audit system? For example, when we have got the EU planned health audit, or the number of interceptions you have in the international market, or the number of interceptions you have domestically before exports? Have you undertaken a critical analysis of the NPPO to determine whether you are doing the work as per your obligations as provided for under the IPPC? So if you can answer those questions, we will then ask ourselves, what is therefore needed to inform us on what must be done to improve our ability to address the issues of market access? It has to come from us. Remember, it is us who are sitting in this forum who understand what the functions of an NPPO is. How do we structure ourselves to ensure that we do what is best for market access? And then the next question, how do we create ownership of the processes as per our obligations? And here ownership, I'm talking about both the public and the private sector. Public, I'm talking about the relevant ministry and other institutions that support our obligations to the IPPC and the WTO. If we are able to address these questions, then we will be able to consider ourselves doing a serious job towards market access. I'm saying this because we know what the WTO SPS agreement does provide. It encourages members to establish national SPS systems. And we know there are those laws that are available touching on animal health, food safety, and phytosanitary measures. And we know that there are various instruments that help us undertake evaluations. For example, we have got the guidelines to assess national food safety systems, which is provided for under the FAO and WHO. we have got the phytosanitary capacity evaluation, a tool developed under the IPPC. Actually, we started the process when I was the chair of the IPPC. Now, the question that you ask yourself, have we adopted this tool in our system to actually determine where are we as an NPPO in addressing the issues that we are required of us? Many times I've heard, this is a very lengthy tool, it takes too long, the information is not available, or we don't know what it is. Now, that's a question that we have to ask ourselves. How do we make this tool work for us as an NPPO, such that we are able to address the issues? We also have the PVS, which is addressed issues to do with animal health. And lastly, we have got the STDF's PIMA tool, which comes into play when you really need to look at where are your priorities in terms of what you do. I want to diverge a bit before I get back to the crust of things. Looking at this, these are tools that are very effective when utilized, and they can actually help you assess where you are as an NPPO, particularly the PCE. But we know for a fact that given the time it takes, sometimes we are not able to have the tool completed very quickly. And we also know that international SPS or phytosanitary matters, particularly with regards to the various markets that we take our products to, there are changing requirements. For example, the EU requirements change constantly. And as the NPPO and as the private sector, we must quickly adopt to the new requirements. Otherwise, our exports will not take place or they will be affected. What should we do to continuously demonstrate compliance of the products that we export with the new market requirements or new SPS requirements? This calls for a rapid way of identifying what our needs are and designing frameworks to address these needs immediately. Yes, there is the PCE that we may be working on, but today, if we are facing a challenge, for example, with FCM, which I believe most of the countries in the SADC region are dealing with, you need to come up quickly with measures to address the need to comply with the market requirements. CABI, which I'll talk about later on, has actually been working with various countries to see how can we strengthen national SPS systems, both covering plant health and the sanitary aspects. And from CABI's perspective, we understand that strengthening of national SPS systems or strengthening of NPPOs is a complex undertaking, given the number of stakeholders involved. For example, in an NPPO in a country like Tanzania, you've got various value chains. They may be in horticulture, they may be on other commodities. How do you quickly get these stakeholders to agree on what must be done, as I've outlined earlier, to ensure that there is compliance with the market? And that's why CABI designed a tool that we call the RSAT, Rapid SPS Assessment Tool, that can help a country quickly make an assessment on where they are. You can apply it for plant health, you can apply it for food safety, or you can apply it across the board. This tool was first developed from 2010 when CABI was implementing a food safety program, and I may have interacted with some of you in your countries. And it has based on 3 principles. One is there is no turnkey solution. That is to say, the needs and the demands that are there in Eswatini are different from Botswana, they are different from Seychelles, they are different from Mauritius, they are different from Mozambique, they are different from Zambia. So you do not have a turnkey solution that would give specific results. So you need to understand what the local specificities are. You also need close consultation between and among stakeholders. That means between the public sector and the private sector, and even in the public sector, there may be different stakeholders, and among the stakeholders, there may be those dealing with different value chains. It may be in citrus, it may be in peas, it may be in capsicum. And you have to take into account a wide range of factors before you come to a solution. So this is a tool that looks at how do you integrate various activities, various stakeholders to come to a solution that can help. For example, in this case, the NPPO comply with the market requirements. The NPPO assure compliance with the market requirements in line with its obligations. So for COLIACP, the principle is, first of all, you cannot define anything for any country. What COLIACP has come up with within this particular model is to look at the value chain from start to end. And therefore, it has defined various components, control points, and criteria that can be evaluated in terms of informing the NPPO, where are you in terms of ensuring compliance with the market requirements and therefore the obligations. And it provides suggestions on how you can assess the system. It defines the steps that must be applied. And to do this, you need to have a good understanding of the landscape with regards to food safety, if you're dealing with food safety issues, phytosanitary measures, or even animal health issues or food safety issues. You have to have a good understanding of the landscape. And that means you have to have the wide stakeholder engagement. And it also takes into account the need to go beyond science, technical, and phytosanitary, and the financial considerations, such that you also look at the human element and also the organization that you require to undertake the activity. And in this case, for example, you may say you do an evaluation, you need additional equipment for the lab, but you do not have the HR component to be able to operate that particular equipment, in which case that particular assessment or buying of the equipment will not address the issues. Or you may want to train your officers, but then after the training, they do not, when they come back, they have no tools to work. And it is also said, where the PCE has been completed, you also take into account, or it serves as the starting point. So in a nutshell, what COLIACP RSAT is that it is based on us considering changing what we currently do to do it better in order to ensure compliance with our obligations. You must have wide consultation and involvement of many stakeholders from the beginning. The stakeholders should not just be consumers of the information. They must be involved from the onset. And you must review your current situation. Why are we having this meeting? It's because there is a need. There's an unsatisfactory situation. Why do we have this current unsatisfactory situation? And where do we want to go? Remember, if you don't know where you want to go, anywhere you go is okay. In order to determine where you want to go or to the desired future situation, you must have a strategic vision to guide the process. And this is a question that sometimes we ask in a number of our countries. What is the strategic vision of the NPPO? And do the end users of your services share in that vision? Or they only see it on your website or on your documents? Because if you have a strategic vision, that vision should be shared with the other stakeholders, either as partners in service provision or in facilitating trade, or as consumers of your service. If they do not share in that strategic vision, it makes it very difficult to move from your current situation to a future desired situation. So for COLI-SCP, we looked at the entire SPS system, or for example, the NPPO system that may be operating. And there are 4 components that we see which become very pillar. One is governance. The other one is operational processes. The other one is skills and competence. And the last one is communication and relationship dynamics. These are the things that would run in any value chain from beginning to end. So how do these work? Think you can see that diagram there. We are at this situation as the NPPO today. I've said we need to improve what we do with regards to facilitating and enhancing trade of our country and thereby enhancing market access. The thing I've just talked about is we need to have the strategic vision. And this is why I've said you need to have a strategic vision that you share with the stakeholders in order to move to the improved situation. And for this, there are 4 pillars: governance, operational processes, the skills, and communication and relationship dynamics. Under governance here, we are looking at the laws that are operating in the country. Remember, we've got the IPPC at the top. So when you come down to the country, what policy do you have in the country with regards to plant health? What laws do you have in place? What regulations do you have in place? What institutional arrangements do you have? And lastly, what business plans stroke financing framework do you have in place to actually ensure you implement the policy? Under operational processes, you are looking at systems that implement what is provided under governance system. If you've got regulations, how do you implement the regulations? You turn them into standard operating procedures. Are there standard operating procedures with regards to risk assessment, with regards to risk management, with regards to risk communication? What skill sets are there? Inspections that are undertaken, auditing that is undertaken. Those are the activities that touch on operational process. And these have to be based on the system that is above there. To be effective with this operational process, you must have this required skill sets and competence. Are the staff capable of utilizing the SOPs that are under operational processes? Do they understand it? Do they use the SOPs to come to the same results? Or do they use the SOPs and get to different results? That is what we look at under the skills and competence. And lastly, the communication that is there between and among the stakeholders. So these are the things that come into play. And you have to look at all of them in totality. If you are going to talk about market access, it is going to come from the operational processes that you implement in the country, which is based on the skill set that you have. Now, are those in line with the laws that are in place? And are you able to deal with the issues accordingly? And have you communicated to the stakeholders? Do they understand what it is that needs to be done? So that is why this model then becomes important for an NPPO, and you can go through it to do the evaluation. So these are the pillars: governance, operational processes, the skills and competence, and then communication and relationship dynamics. I can break it briefly. You can see under governance, I've talked about the plant health policy. Does it exist? What laws and regulations, standards governing SPS are in place? The institutions handling SPS, how do they operate? Do they have a business plan and financial framework for SPS? These are the things that will come under, you'll make an assessment under governance system. And then you would also look at the operational processes that are in place, the capacity to undertake risk assessment, as I've indicated, management of inspections, laboratory testing, crisis management, audit systems. And then we've got the skills and competence, programs for organizing and developing skills, mechanisms enabling training for stakeholders. This I'm talking about stakeholders is both private and public. And then lastly, of course, the communication that is there between the stakeholders on SPS issues and also educating the population on SPS. How do we communicate? When there is a new law, did the stakeholders get involved in the process of formulating the law? What was their contribution? Have you communicated this to all the stakeholders? These are the critical things in terms of evaluating the NPPO's operations with regards to market access. Now, for each of these activities, you can actually split them into 3 levels. And this is what we call the criteria, where you talk about the basic, where activities are neither formalized nor systematic. If you look at your own country, if it is Zambia or Zimbabwe or Tanzania, name it, where are you with regards to the pillar, for example, you have a national planned health or a planned protection policy? You have laws that govern the system? Are there institutions that handle it? So using this system, you can have the 3 levels where activities are there, activities are formalized, or they are fully compliant with the international requirements. And through this, you can look at what is within your system. For example, if you have to look at the national planned health policy in your country, you can say you're at basic level if the national policy is defined with precise objectives. You can say you're at medium level if the national policy is defined on the basis of risk analysis and includes performance indicators. Remember one of my earlier questions, when do you say an NPPO is performing well? And lastly, advanced is that the national policy is regularly updated, that you do not have a static policy. You keep updating it based on the evaluations that are ongoing to inform what needs to be done on a continuous basis. There is a new market requirement. For you to have a market access, you need to have an adjustment to your policies and regulations and the processes. So it becomes a continuous process that you do within your country. So this is an example of how you could look at the issue of governance. So under this tool, you would then end up with 4 components. And I've said the 4 components are the governance, operational processes, the skills and competences of the staff, and lastly, communication and relationship dynamics. You can have from these, remember I talked about 3 levels, medium, basic, medium, and advanced. You can have 15 control points to each one of those. So you'll end up with a number of criteria, which will go to 45. And then you can look at maturity level. I've not gone to that explanation for the sake of our meeting. So through this RSAT tool, you can quickly assess where you are as a country with regards to market access. And to do this effectively, as CP, we say, you go per value chain. You may probably use it on, for example, citrus. You may use it on peas. You may use it on capsicum, or whichever crop you use. Because if you do that, you can have enhanced discussion among the stakeholders, and you can rate yourself where you are and quickly identify the areas that you need to improve, particularly if you are focusing on market access. But to do this, you need to ask yourself critical questions. What is our current situation as an NPPO? And what do we require to move to the desired situation? In this case, I've said you need to have a strategic vision which is shared with and among all the stakeholders. The next question you need to ask yourself is, what minimum level of improved capacity will be necessary for the NPPO to function effectively and efficiently? Do not use, we used to call it bulldozer. You want to improve everything at one time. It will not work given our resource base. So you need to do it piece by piece, but you start with where you need to improve most, and what has got multiplier effect. And then you need to ask yourself, what are the critical needs for strengthening of the NPPO? And a key question is, what is essential or what is merely desired? You visited CAFIS in Kenya, or you visited the NPPO in Netherlands, you visited the office in US, and you saw something being done, and you quickly say, we should also have this. Is it essential or is it desired? And do you have the capacity to implement what you're really looking at? And those are the questions. The key considerations would be, you need to focus on what will be necessary to ensure compliance for the NPPO to deal with the issues of market access. And in this case, you will need to time which one comes first, which one comes second, and which one comes third. Because I've given things that you can use to look at rating, but which one of them becomes critical? Second element is you need consensus on the nature of the desired future situation. If the stakeholders do not agree on where you need to go, it becomes a big issue. So you really need to have consensus discussion among the stakeholders within the NPPO to move what it is that you need to get done to get things correctly. Constructive engagements are always necessary. Not everybody will buy in, but you need to have everybody engaged, and transparency is always a key input. And when it comes to looking at priorities, there are 3 possible scenarios. Through the NPPO activities, discussions, everybody agrees this is what must be done to enhance market access. So you can quickly develop something. Secondly, you need to have a properly argued out list of assessing what it is that you must do. We call it a pragmatic approach. Or you need an in-depth structured prioritization in order to determine what to do. And this is where we say the PIMA framework is very essential. Now, there are 2 very important factors. As an NPPO, what is important for you to get things going? And it is urgent. For example, you went through an audit, a EU FVO audit, and they determined that you must do certain things within a given value chain. So that then becomes a key important thing. And then you also have to look at it. What is the risk of non-delivery? Do not, because every time you say this is urgent, you also need to look at, supposing I fail, what happens? And we have got various examples of risks that may occur in the system. Technical, you come up with proposals that are too complex to implement. Legal, the laws will take a long time to actually get implemented. Timing, you will not be able to implement the activities as and when you require to do it. Financial, the proposals are too expensive. I think you heard what our EU colleagues said. You come up with the proposals, they need to look at the budgets that are available, become too expensive. Or the commercial, what you are proposing will actually impact on the competitiveness of the industry. So as the NPPO, you will not be enabling market access. Social, if something destabilizes the social relations, you really need to look at it. What does that mean? Environment, the recommendations may be too difficult to get things going on. And then, of course, there's the element of coordination with regards to what is done, who is going to do what, and there might be challenges in terms of how it gets coordinated. And then competences, the competences that are within the NPPO, within the stakeholders, how do you utilize it? Is it going to be available for the activity or not? And then, of course, lastly, the image for the NPPO. So those are things that COLIECP has put in place to help countries address the issues that relate to market access. And we have programs that support SPS challenges across ACP countries. And this is an example of some of the activities. Fit for Market, I think we are engaging with a number of countries in southern SADC region. And then we've got, for example, the program I'm heading, which is in Kenya. These are the various activities that are there. And we are working in over 53 countries. And you can see the map there. So we are normally based on people requesting for intervention. We do not just intervene. The expertise that is available covers a lot of things, training, market intelligence, information and communication, business development. And thank you for listening to me.